Okay. My name is Gaylynne Clark, and I will be performing a head, eyes, ears, nose, and throat exam. First thing I would do is gather my equipment. For this exam, I will be using an otoscope, a pen light, and I have a pair of gloves. So, upon entering the room, I would introduce myself. Hi, I'm Gaylynne. I'll be your nurse for this evening. I would also perform hand hygiene, soap and water, or hand sanitizer. Next, just by the first step of assessment, I would do my inspection. I can tell just by looking at my patient that he is neat and clean, he's alert, no obvious physical deformities. Next, I would ask my patient to please tell me who you are.
I'm Mr. Patton.
This is Mr. Patton. Mr. Patton, do you know where we're at right now? What town?
Springfield, Missouri.
Correct. And can you please tell me the date?
It is September 10th, 2015.
Okay, Mr. Patton is alert and oriented to person, place, and time. Next, also, I would inspect his mood, his affect. He's very pleasant and cooperative. Mr. Patton, I will be performing a head, eyes, ears, nose, and throat exam. I will start with the head, move to the eyes, nose, mouth, and then throat. First thing, I'm going to palpate your skull, and I will do this just by feeling your scalp, your hair for any deformities. And it is symmetrical. I'm also palpating his temporal artery here, and it is palpable. Next, I'm going to press around your eyes and nose for your sinuses. Tell me if you feel any pressure or soreness.
No pressure, no soreness.
Okay, good. Next, I'm going to perform the eye exam. Mr. Patton, do you wear contacts or corrective lenses?
I wear contacts.
He does wear contacts. I do not have the Snellen chart, but to perform a Snellen test, you would have your patient stand 20 feet from the eye chart, and they would cover up one eye and try to read the smallest line possible, and then, of course, do the other eye. So, I have a light here. I'm going to use my otoscope. And right now I'm just inspecting the cornea and conjunctiva. It is free of debris. The sclera is white. Okay, I'm going to pull down your eyelids just a bit. And it's nice and pink, normal. His eyelashes and eyebrows all symmetrical. Next, I'll be checking the pupils for equality, reactive to light, accommodating, and size. Go ahead and just stare at my nose for me, please. I'm going to shine a light into your left eye and watch for constriction. The left eye constricts, and so does the right. Same with the right eye. Right eye constricts, and so does the left. Now I'm going to check for accommodation. If you would, just follow my pen light, please. Now look at my nose and look at my light. Pupils do constrict at the closer object, and then they dilate when the object's farther away. Next, I will test for the ocular muscle movement, if it's intact, as well as the cranial nerves. If you would, just follow my finger. Go lateral, center, lateral, center. His eyes are moving normally. Cranial nerves are intact. Next, I'll check his peripheral vision. If you would, just go ahead and tell me yes once you see my hands. Okay? When they come into sight.
Yes.
Okay.
Yes.
Good.
Yes.
All right, peripheral vision is intact. Next, I will be inspecting the nostrils just by visual inspection. His nostrils are symmetrical. Checking for patency, I will occlude one nostril and go ahead and breathe in for me. Okay, patent, and again. Nostrils are patent. Next, I will inspect inside the nostril, check for polyps, occlusion, deviated septum. So if you would hold your head up just a little bit for me. Not to shove it too far. Okay, nostrils are clear. Next, we will go ahead and inspect the ears. I do have my otoscope for this, but first, visual inspection. I will be checking the ear canal as well as the auricle pinna for any redness, swelling, or drainage, which there is none in the right and none in the left. I'm going to palpate. Tell me if you have any soreness or pain.
No soreness, no pain.
Okay. Let's check for hearing. I'm going to occlude one of your ear canals and whisper a word. Okay. Baseball.
Baseball.
That's correct. Apple.
Apple.
And that's correct. He passed the whisper exam. Now I will be looking inside the ear canal, be looking for the tympanic membrane to make sure it's intact or any kind of abnormal drainage or lesions built up cerumen. And I'll be pulling the pinna up and back on adult. The tympanic membrane is intact on the right. And the tympanic membrane is easily inspected on the left, and it is also intact. Next, I'll be inspecting his mouth. Throughout the exam with his questions, his speech is clear. Visual inspection, the lips, they are not chapped, they're symmetrical, no lesions, sores. Okay, go ahead and open your mouth for me, please. Inspecting the oral mucosa, it's pink, moist, free from lesions. Stick out your tongue and say ah. Cranial nerves intact. Okay, go ahead and stick out your tongue to the left and to the right. Still free from lesions. Lift your tongue up. I'll just slowly palpate the palate. Gums are pink, moist, teeth free from cavities or break. Okay, good job. Last thing will be the throat or neck assessment. Again, first thing is inspection. The neck is very symmetrical, free from obvious deformities. First, I will be palpating for the lymph nodes. First, we'll start with the pre-auricle, post-auricle, occipital, jugulo-digastric, submandibular, submental. The deep cervical are not usually palpated. Go ahead and turn your neck for me to the right. Okay. Supraclavicular. Okay, very good. Last thing, I'm going to palpate for the thyroid gland. I'll do this from behind. First, find the cricoid, and then come to the side. Go ahead and swallow for me. Okay. Also, you can palpate the carotid pulse. You, again, would find the trachea and then move over to the side. I can easily palpate his pulse. Range of motion, go ahead and put your chin to your chest. Now look up to the ceiling. And back down. Turn your head to the left and to the right. Any pain at all with movement?
No pain.
He's able to move without any kind of discomfort. One more thing, we will check for muscle strength, and I'll apply a little bit of resistance. Turn your head to the left. Good job. And to the right. Very good. And that concludes our head, ear, eyes, nose, and throat exam.